Hi, Kevin Henry, the Group Editorial Director of Dental Division and Modern Hygienist, and I'm on a Google Hangout today with America's Dental Hygienist, Anastasia Turchetta. How are you this morning, Anastasia?
Hey Kevin, doing great. Daylight savings time.
Woo! Here we are, longer evenings and earlier mornings, so
It's
it's all
about
good.
time.
Well, let's talk a little bit about a topic that is taboo in some places and not in others. Let's talk about marijuana usage and how it affects oral health. And Anastasia, tell me a little bit about some of the research that you found about this.
Kevin, it's so interesting because now that more states are legalizing marijuana, I think we're going to see more oral effects than what we had thought before. And when you take it from a hygienist perspective, there are 5 things that we should really be looking at. But overall, is it something that's, I think a lot of people get on the bandwagon because, yes, it's a drug, it's obviously an illegal drug in some other areas, but it really does help the body handle certain things, especially those with going through chemotherapy, patients with Alzheimer's disease. I mean, just it's amazing how many benefits it has. But then again, to everything that has a benefit, you're going to have a downside to it. So the 5 things that we should look at in the clinic or in the dental practice, one would be for xerostomia. I mean, anybody who is using marijuana, it depends on, we have to go through that medication list in the health history. That being said, 4 or more medications, you're at risk for dry mouth or xerostomia. That includes marijuana use, and I'm not quite sure we're asking that on health histories. Another one would be leukoplakia, which is, the white areas in the tongue. We kind of look for that for oral cancer screening. So generally, if you're looking for that with your patients, I would encourage, yes, look for leukoplakia. Also, in addition, I didn't know this either, but uveitis. So look at the uvula. If it's swollen, sometimes that is a symptom of marijuana use, more often than not. I found that pretty interesting too. Then, of course, you can go into gum disease. So that would be the 3rd one. Interestingly enough, it's really found on the anteriors. So you're going to look at the anterior gingiva. If it's inflamed, like if somebody's taking the medication Dilantin, that could be a symptom that somebody is using marijuana, and the patient needs to know. We've got to go over the oral hygiene instructions and let them know there's a correlation. Then, of course, you're looking at dental caries, if it's xerostomia or dry mouth. And then finally, this is really interesting, hygienists who are becoming certified or licensed to deliver local anesthetic. Let's just say you've got a patient with dental anxiety. They come into your office, they're already kind of hyped up and nervous. Yet, if they're using marijuana pretty frequently, using that and epinephrine can lengthen the tachycardia that patients will elicit. So you want to make sure we're asking the right questions because that could be a bad scenario medical-wise.
So if I'm a patient coming into your practice and you suspect that you see some of these warning signs and you think that maybe I've been lately, and how do you bring that up? You talked about the health history form. I mean, it's a little bit of a taboo topic in some states, and some it's a little more wide open. But how as a hygienist do you bring that up with a patient?
I think it's a great question. And how do you? Because let's face it, some kids, I don't have children, but some kids under the age of 18 are already using marijuana. So how do you bring that up? And if you're seeing symptoms like I just expressed outside of obviously the local anesthetic, I feel it just goes back to the information. I'm noticing in that, I see this, your anterior gums, or they're swollen. These are some reasons why sometimes your gums are swollen. Blank, blank, blank. And you know what? It's not really addressing them or pointing a finger at them, but it's just sharing with them something in your lifestyle is contributing to this.
And so really it's something that's brought up just as easily as smoking cigarettes or excessive alcohol use or whatever that might be. Is that right?
Exactly. I think the point is to make, no matter what age the patient is really to put yourself in their shoes. How would you want to be addressed? And it is about information. It's not about pointing a finger and going, oh man, they've got some weed, or I bet they can, whatever the case may be. It's really informing them about health. So you're not saying it's good or it's bad or it's different. What you are saying is, I've noticed these conditions in your mouth, and I just want to share with you some reasons why this could be happening.
I know some dental practices have little, printouts or information sheet about, if you smoke, this could happen, or or excessive alcohol use or whatever. Is it something where maybe the dental practice should even think about printing out something like that, or is that too in front?
Actually, I think they should put it in their newsletters. They should even put it, yes, put it in the goodie bags, put it somewhere where people can read it. So if they want to, they can put it on your websites. The more information that we talk about it, it doesn't make it that taboo topic anymore. This is real. We're seeing symptoms. So I gave you 5 areas to look at within the dental practice. Why aren't we doing that and educating our patients? It's really for their best oral health.
And Anastasia, the last thing here, I'd really like for you just to take a minute to really speak to your fellow hygienists out there about, again, the importance of them being the point of contact and really that relationship with the patient that they can build even over a topic such as this.
Well, I encourage you. I mean, most hygienists that I know, these patients are family to them. So they see them every 6 months or every 3 months, or sometimes even like with the kids, they've been seeing them since they were like 3 or 5. And now that they're getting older, it's very interesting. I mean, you've got to pay attention, and they trust us. And you know what? It is a wonderful, intimate relationship. And if you do see signs, as what we just discussed with marijuana, it's important to just open that door and just say, you know what, I've noticed xerostomia or, gingivitis, and this could be some of the reasons, and I just want to let you know. So if everybody just has to keep the topic open, and I think it depends on that relationship, and they'll know what to say.
Sounds good. Always good advice, Anastasia, and really appreciate your time this morning. Thanks so much.
Thank you, Kevin.